First thing I'm going to do is I'm going to try to get it over your fingers, and then we'll worry about your thumb, okay? So I'm going to worry about putting the patient's fingers in first, not worry about the thumb right away. And then work the thumb in. And then use the seams to get good contact in the web spaces. And pull it as far up as you can get it. And then use a piece of gauze or 4x4 to just floss in between and make sure you have good contact in the web spaces. Wrap the glove with the gauze to hold it in place. Finger netting on each of the fingers, just a bit longer than the fingers to the end of the hand. And you want to cut those about 1/3 to 2/3 of the way up. So you have a nice long tail to keep it from moving. And hold it nice and wide so that it slides on easily, maybe doesn't hurt the patient as much. And you want to make sure the netting gets all the way into the web spaces so that it's holding the dressing firmly against that web space. Okay, go ahead and put all of the fingers, there you go. Good. And you can kind of pull on all of the little ends here to make sure that the dressings they all have good contact and they're in place. I'm going to make a hole here on the thumb side. Good. And make a second hole here on the pinky side. And these holes are going to keep the dressings from migrating. So this is how it's going to look when it's done. Minimal gauze will allow the patient to move. You can bend your fingers and still keep everything in nice contact.